Good evening. This is Lisa Whitty Bradley, a board-certified plastic and reconstructive surgeon and CEO and founder of Chicks with MDs. Thanks for coming and joining me tonight for Friday Night Chats. First, let me just tell you a little bit about me, and then we'll get into our discussion for tonight, which is healthcare disparities, really looking at the recent death of hip-hop pioneer Craig Mack. I started this company about 3 years ago after I was diagnosed with multiple sclerosis, and I had to figure out another way to be of service and to make sure that patients and physicians continue to be educated on critical topics that affect us all. The mode of communication that I use mostly is social media. However, I do in-person lectures, and I also travel a bit to make sure I get word out. I talk at churches, medical schools, community centers, a variety of different avenues. I also consult with different physician companies to help them educate physicians on a variety of topics, including disability, contract negotiations, a whole host of things to just try and help educate folks. And what I want to focus on, first of all, I want to say rest in peace to Craig Mack and his family and everybody who has been impacted by his art form. It's reported in the news that he died at 46 or 47 years of age from congestive heart failure, which is a pretty aggressive disease, and that's an early time of death for anyone with congestive heart failure. Hey, Dina, thanks for watching. Please share this post and get some more folks on here. I know this is like not the most sexiest thing for folks to discuss on a Friday evening, but I just want to make sure folks are getting this information. I'm going to try and share it on my side as well. So the main thing about knowing about congestive heart failure is that it's usually associated with long-term coronary artery disease, a history of heart attacks. Sometimes it can be associated with congenital disease. However, it usually does not impact somebody in their 40s. However, if you look at the history of hip-hop, there's been a significant number of artists who have died prematurely, whether it's Big Pun or Biggie and Tupac with the violence, Big L with violence, and then now Craig Mack with heart disease. And then recently, Rick Ross was hospitalized with, I believe that was heart disease as well. And if you look at just people on your timeline or your family members and friends, there's a significant number of people who are being diagnosed with heart disease, diabetes, chronic medical conditions, and oftentimes they are succumbing. That's right, Heavy D. Heavy D, I think, died from pulmonary embolism from, I think it was a prolonged plane ride, but once again, young. And I really want to talk about health disparities, of which that's right, Fife dog died from kidney disease, which and took him very early on in life. And if we look at the people in hip-hop, they are reflective of our communities. And unfortunately, access to money does not decrease your risk of succumbing to some of these diseases, especially when your diet, your lifestyle, and your access to care don't change, even though you have access to more money. So I want to talk about what are the top 10 causes of death just across the board, irrespective of race. And that is heart disease, cancer of usually lung and breast are at the top of the list, also prostate, trauma or incidental injuries is number 3, respiratory disease, stroke, Alzheimer's, diabetes, suicide, influenza and pneumonia, kidney disease, those round out the top 10. And when you start to look at the incidence and the death rate, or the mortality rate is what it's called in the medical literature, when you start looking at recurrence of disease, aggressiveness of disease, unfortunately, the African American population marks high on all of those poor outcomes. And some of that has to do with health disparities, meaning education, access to care, and being marginalized in the population, having a higher risk of poverty, poor diet, poor exercise, crumbling educational systems. All of those things impact your not only your access to health care, your education about what your disease process is, and your propensity to go out and seek preventive care, and not to mention acute care. And there are certain things that are fixed that we unfortunately will take decades and generations to overcome, which includes those health disparities. However, the things that we do have control over are educating ourselves, which is what I'm trying to do with this platform, and then also making sure that we are aggressive about preventative care. There are laws on the books right now, which is the Affordable Care Act, which makes sure that your insurance companies have to cover preventative care, such as immunizations, breast cancer screening, colon cancer screening, prostate cancer screening, HIV and sexually transmitted disease education and treatment, diabetes evaluation and treatment, high blood pressure evaluation and treatment, heart attack risk assessment and treatment. So there's a variety of things that right now, by law, the insurance companies have to cover, usually at no cost to the patient. Now, there are unfortunately some healthcare plans that were grandfathered in and still have stipulations that the patients have to come out of pocket with a certain amount of cost. So I would make sure you find out from your insurance company whether or not you have any out-of-pocket costs. And if you do, you can talk to the insurance company or your local health clinic, or go online to healthcare.gov and find out whether or not you have access to federal funding. Usually you do. But, unfortunately, these things are not just going to be in plain sight. A lot of times you have to be aggressive about going out there. But once you fill out the forms and talk to the healthcare providers and the healthcare companies, then you will usually get access to that supplemental funding. So hopefully you won't have any out-of-pocket costs. Also, in areas, in communities that are at risk, meaning areas that are impoverished, a lot of times they will have like mobile breast cancer screening where you can get mammograms on site. They will come to your church or your community centers. So there's many, many ways to get access to care. But being educated about that care and reaching out for that care is really going to be instrumental. And so please share this on your platforms and share it with your family and friends. I'm also going to list links in the comments about just these facts that I talked about, and then also links that you can utilize to get access to low cost or free care. Other things that I wanted to talk about is, what role do we have in taking care of ourselves and doing preventative management? Well, major, okay? Because many of the disease processes that I talked about on that top 10 list, including cancer, heart disease, diabetes, kidney disease, those are there's a high risk of developing those diseases if you are overweight or obese, and we have complete control over that. So going for your annual visits with your physician or your healthcare provider, finding out if you are overweight or obese, usually and then finding out about how to modify your diet and what exercise and activity level you can tolerate, which is another reason why you need to be evaluated. Because if you're overweight or if you have chronic medical conditions that you're not aware of until you have this evaluation, there are certain exercises or certain things that you should not be doing until you have clearance from your physician or your healthcare provider. So make sure that you guys are getting evaluated. And then once you've been cleared to, increase your activity level and modify your diet, then you need to do those things. You also need to be very clear about what you're eating. A lot of people think that if they're eating greens, that's a vegetable. Well, unfortunately, when you cook greens, most of the time you're using preservative-laden smoked meats, which puts you at higher risk for cancer. And then on top of that, you're cooking the greens for 2 and 3 hours. So there's no nutrients. All of the nutrients are actually in the juice, in the fluid of the greens. So you need to talk to your providers about what type of vegetables you're eating. Also, you need to be drinking water. You need to eliminate the soft drinks, the sodas, the caffeine, alcohol, tobacco. These are all things that are putting you at increased risk. Preservatives, high salt. So I see a lot everywhere I go, either in the stores or out on the street, like garbage. I'm seeing bags of hot Cheetos and Flamin' Hots. There is, and my husband just came and showed me a bag of barbecue potato chips. So I guess I also need to take my own advice. So, oh, hey, Melena, thanks for joining. So things that you have control over are the preservatives in your food, salt intake, how much water you're drinking per day, eliminating sodas and soft drinks, and also increasing the amount of fresh vegetables and fruits that you're eating. And then we talked about your activity level. So once again, I'm going to just reboot. I'm Lisa Whitty Bradley. I'm a board-certified plastic and reconstructive surgeon, and we're talking about preventative care, and we're addressing why there seems to be a higher incidence of younger folks succumbing to chronic medical conditions like Craig Mack recently dying, and Big Pun, and Fife Dog, and all of these people that are in the public eye. So we talked about what control we can have over healthcare, because there are certain things that we can't change, unfortunately. Some people just don't have high income, so they don't have access to, some excellent medical centers. So you want to make sure that you're utilizing all of the things that you have access to. So doing your annual visits, making sure that you're taking advantage of the preventative screening studies like breast cancer screening, colon cancer screening. Breast cancer screening should start at 40 years of age unless you have a strong family history or personal history of breast cancer. Then you may need to start your screening earlier, which is another reason you need to see your healthcare provider to see when you need to start the screenings. The other thing is colon cancer. Colon cancer screening on average starts at age 50. However, there's a higher risk of colon cancer in the African American community. So you need to talk to your primary doctors about whether or not, based on your personal or your family history or your ethnicity, if you need to start your screening earlier. And other things, immunizations, vaccinations, you should all be getting the flu vaccine annually unless your physician or your healthcare provider thinks you're at increased risk for complications. If you're immunosuppressed or immunocompromised for any reason, then you need to talk to your healthcare provider. Or based on if you have a newborn, that newborn can't get the vaccine yet. So you need to talk to your healthcare provider and see whether or not you're a candidate. More than likely you are. So talk to them and see whether or not you can get the flu vaccine. You should be getting that every year. Other things you can do, we talked about salt intake, preservatives, alcohol use, tobacco use, cardiac risk screening. So there are some people who, you may be adopted or you may be estranged from your family, so you don't know what your family risk factors are for heart disease. So you want to see your healthcare provider, get your blood pressure checked, your heart rate checked, go over your diet, go over what your exercise level is. Sorry about that. Because there are certain things, most of the things are, most of the things that put you at risk for heart disease are things that we can modify and control. If you have a strong family history of heart disease, those are things that you're not going to be able to control. However, you can control your salt intake, get your cholesterol under control, get your blood pressure under control, increase your activity level. So we have to be aggressive about taking care of ourselves. So we talked about health disparities, education, access to care, your compliance. Okay, that means that when your physician or your healthcare provider gives you a strategy or a plan, you have to then abide by it. We see a lot of folks who we say, okay, well, this is what we're going to do. We're going to put you on this protocol, modify your diet, increase your activity level, and then I'm going to see you back here in 3 months for a check, and they come back and we haven't been active in the plan. So you have to be active in the plan to get your health improved. So be an active participant, because that is how you maximize your health outcome, decrease your risk of dying, decrease your risk of being hospitalized. We got to be aggressive in our care. Lifestyle adjustments. I'm going to tell you something right now. I like Popeyes. I like Church's Chicken. I like barbecue potato chips. I can't have that all the time. Okay? So you have to be willing to modify your lifestyle to improve things and to decrease your risk of having complications. So those are the major things I wanted to discuss with you all. Also, just in terms of the heart disease, because that is the number one killer across the board. Okay, so particularly for women, you're not always going to have, if you're having a heart attack, you're not always going to have that crushing chest pain that people talk about. Sometimes you have discomfort in the upper part of your abdomen. Sometimes you have shoulder pain. You may have pain that goes from your shoulder up to your jaw or your neck. You may have a heavy feeling. You may all of a sudden start sweating or feel weak. Things that are out of the ordinary for you. If you have any of those things, or you're having multiple episodes of that, call your doctor up, call the urgent care, or go in and be evaluated. We would much rather you come in and it's your gallbladder, or you're having an anxiety attack, whatever. We would much rather see you and say, oh, this is not a heart attack, than you stay home and ride it out, and God forbid something happen to you at home because you haven't gone for care. So the other thing I want to stress before I get off the line is obesity. Unfortunately, many of the things on the list that of the top 10 things that cause death in the United States are related to obesity. And unfortunately, there's a lot of shame associated with saying that you're obese. There's a lot of stigma associated with being overweight. The main thing is to be aggressive about your care, okay? Not everybody is supposed to be rail thin, but we are supposed to be at a healthy weight. And, a lot of times we see people in the office and they say, well, I have diabetes because everybody in my family has diabetes. But then you look at their family line and everybody's overweight. And so that is what is putting you at higher risk for developing diabetes or pre-diabetes. So we have to get that under control, because it's not just the fact that your blood sugars are high, it's the fact that that uncontrolled blood sugar is also causing kidney damage, heart damage. It's putting you at higher risk for stroke. Okay, so we have to get this. We can't just look at it as, okay, I'm obese and I'm just going to be this way. We have to be aggressive about managing our weight and increasing our activity level, because a lot of these diseases are also secondary to us not being active. So that's another reason to go in, be evaluated by your healthcare provider, and get a plan of action on record, and then you can work on how you can improve. And nobody is expecting this to be an overnight process. You didn't develop these diseases overnight, so we don't expect them to be resolved overnight. But what we do want is for you to be aggressive in taking care of yourself. We know you have a lot of responsibilities. We know that you got families, you got to work. It's hard to get home and eat and cook every night. It's cheap and it's fast to go and get something on the way home. We know it. And so does the fast food industry. That's why they make things very appetizing. So, if you have a crock pot, do meals in advance. You can also do meals in advance and freeze parts of them. There are a lot of docs and health advocates here on social media that do meal preps. You can just Google meal prep or put a search in on Facebook for meal prep. There are so many folks out there that have awesome meal prep plans. And if anybody watching does meal prepping, put your Facebook page in so that folks can go over and take a look and follow you and get this information, because there are so many different ways to improve your health and your life. And when you are not carrying all that weight around, when you can breathe better, when you can walk better, when your hips and your back and your neck and everything aren't in agony all the time from carrying all that weight, you're going to be more inclined to exercise and take care of yourself. So it's a process. We know that. We just want to give you the tools to start the process of taking better care of yourself. So please share this broadcast. We'll do another round of Friday night chats. I'll put up the link when we have another topic. If there are topics that you are interested in, or if there's something in this discussion that you have more questions about or you want to make a point about, please feel free to put it in the comments. Share this post, and I'll see you next time. Take care of yourself, be safe, and be well. Have a great weekend.